As kids get back to more group activities, doctors are seeing a rise in head injuries, some leading to concussion. In today's Healthy Dose, we talked to Dr. Patrick Mulroney, Medical Director of Sports Medicine at Johns Hopkins All Children's Hospital. You've likely heard of a concussion, but do you know what it is?
So a concussion is a head injury that happens when the head is jarred and the brain moves. It's actually not something that you can see on CT scan or MRI. It's not something you can visualize. It's actually a metabolic or an energy event that happens in the brain that causes patients to have headache, dizziness, maybe foggy thinking, and other symptoms that change their mood and their behavior.
With any activity comes its risk.
You can get a concussion from any type of injury where your head or body is jarred and it causes jarring of the brain. So kids can have concussions from skateboarding or from falling off a swing set, in addition to playing contact sports. But I've seen them in non-contact sports as well, from a child just having an accident with hitting a wall or hitting the bottom of the pool.
He says parents pay attention to that initial symptom after a fall or an injury to the head. Dr. Mulroney says make sure your child stops what they're doing to rest.
So don't put them right back on the bicycle or right back on the monkey bars. Allow them some time to figure out what's going to happen here, and then ask them about their symptoms. In a child who's vomiting or who loses consciousness, if they were to have a seizure, those are things you need to present to the emergency room right away. For somebody who doesn't have those symptoms right away, but maybe has mild headache or just isn't acting quite right, it's probably best to pull them out from those activities and have them see their pediatrician. But things that kids typically will complain of is headache. They'll complain of dizziness. They'll be sleeping more often. They just won't be as active or won't be playing the same way they did in the past.
Dr. Mulroney says most concussions will resolve in 10 to 14 days, but in some cases, they can last up to months. On 10tampabay.com, he explains the biggest thing kids need to avoid after a head injury and how that could impact their daily schoolwork.